CO2 detector to determine if the tube is in the right spot, and the way that you know it's in the right spot, when you ventilate the patient, it turns yellow. It turns from yellow to purple, yellow, purple, yellow, purple. If you have no color change, like it's a lavender right now, if you have no color change when the patient is being ventilated, it's not in the right spot. So also for the spinal, don't only tell me that this is a CO2 detector, tell me how it works and what it does. Do I need to repeat what it does and how it works? Yeah. Okay, CO2 detector tells if the endotracheal tube is in the right spot. It changes colors from yellow to purple, yellow to purple. That means it's in the right spot. If it stays lavender and no color change, it's in the wrong spot. So that patient needs to be reintubated. This is kept in the emergency travel bag. It's not kept in the anesthesia cart, it's kept in the travel bag. Okay?
So yellow to purple.
Yellow to purple, purple to yellow, however you want to phrase it, but it changes colors. Yellow to purple, purple to yellow. These right here are EKG stickers, the little electrodes. I want you guys to be able to, on final day, put them on the right place on this mannequin. We'll go over that today, okay? We're gonna do 3 lead and 5 lead. This right here is a blood gas kit. So when you come up here, take a good look at this. I don't wanna open it because it has a needle on it. It's a blood gas kit, okay? Right here, these are McGill forceps, okay? McGill forceps are used when there's a nasal intubation. Sometimes when you try and guide the nasal tube down, it doesn't go into the trachea. So what the anesthetist does is she looks into the mouth, she grabs the tip of the tube and guides it into the trachea herself. These are McGill forceps. They're always kept in an anesthesia drawer. So know what these are and what they're used for. They're used to guide a tube into the trachea. What is this? What kind? What number? This is a number 3. Okay, I want you to know a number 3 versus a number 2. I'll see if they have a number 2 in the drawer. This is a number 3. The way you know the difference, let's see if they have a number 2 in the drawer. Here's the difference. It's longer. A Miller 3 is longer. They also have a Miller 4, which I've never used, but it's longer than a Miller 3. This is the way you know the difference. This is a regular Miller 3 blade with a regular bulb. This so happens to be a Miller 2 blade with a fiber optic bulb. The way you know it's a fiber optic bulb is green. So know that. What is this?
Miller.
What number?
2.
This looks like a number 2. Actually, it's not. It's a number 3. So also, these blades comes in the same numbers. 3, 2, 4. What is this? It's called an oral airway, oral pharyngeal airway. Comes in multiple sizes, but the sizes that I want you guys to be familiar with is 80, 90, and 10. Small, medium, large. Okay. They also come.
Are they always colored the same colors, like?
It depends on what company you buy them from. Sometimes they're plain, and it just has the number written on there. They're not always necessarily color coded. These are for the little babies. Okay. depends on a different company. This right here is an 80, and with this particular company right here, well, it's an 80 as well. But they're not necessarily, each company does it their own way, okay? What is this?
You can tell us the function.
That's a nasal
Nasal what?
tube,
Nasal
airway.
pharyngeal airway. And it is used for dilating the airway. Comes in multiple sizes, small, medium, large, but they usually go in sizes like 8, 9, 10, or 28, 26, etc. Okay? What are these? Are you guys recording, or what are you doing? I mean, you got lights shining on me and stuff. What's going on?
You looking fly today. That's the Dexchlorine and all of that stuff, the vaporizers.
Okay, but for the exam, I want you to know exactly what it is.
That's the Dexchlorine.
This is isochlorine. What is this one? Desochlorine. What is this one?
SIVO.
And these are always color coded. So can I put this in a purple vaporizer?
No.
Can I put this one in a yellow vaporizer? Why not?
Because it's locked. It has a
Why
lock.
won't it allow me to do it?
Because there's a lock code.
You
It's a
said
pin
right.
code.
Why won't it allow me to do
the
it?
lock is
It's a pin code.
specific to the bottle.
Okay. Not specific to the bottle, no.
The pin code.
To the pin.
The lock
To
code.
the key that's used to inflate the bottle. I mean,
Oh.
to insert the bottle, okay? Aaron, can you like do that without the light?
I sure cannot, I mean, can't. Uh-oh, the wrong thing.
Okay, what is this?
It's a breather.
It's a circuit. So, is there a difference between this circuit and that circuit?
Yeah, it's got
What's the difference?
They don't have the white piece. Yeah. Maybe.
No, the only difference is it goes to a different machine. You wouldn't know that. But anyway, it's a different circuit. It serves the same purpose. And the particular machine that this one goes on, it only has one tubing instead of two. This machine right here has two tubings for this circuit. Two tubings here for this circuit, and evidently this one has one as well. So it can have one or two circuits. I mean tubings, okay? It's all corrugated tubing and it stretches. How often do you change this?
Once a day.
Wrong.
Every
How often do
case.
you change
Every
this?
case.
Every case?
Every single case.
Oh.
Alright? Unless you work in a facility that's trying to save money and
They
they wash them, but that's rare. But you change this every single case. What is this? Okay, you gotta, if you write bag on your exam, it's wrong. What is this? Okay, this is not an ambu bag.
The amber bag
This
is
is a
blue.
reservoir bag. So if you write ambu bag or reservoir or bag on your test, it's wrong. Okay? What is this? It's a CO, it's sample line, but it connects to this circuit to monitor CO2, okay? This tubing connects to the circuit right here. This then connects to this right here, okay? Which monitors our end-tidal CO2. You have to have this in order to have a complete closed circuit. If this is not hooked up, you're gonna hear air coming out, which means you have a leak, okay? This is what? Okay. Okay, Shamir, what is this used for? Yeah, I saw you ducking. What is this used for?
Innovation. If you can't get it, if you can't get the innovation, you get that.
So, difficult intubation.
Yeah.
Alright. Jill, what's this?
Oh, it's, ET2.
Nope. Anybody?
Angie,
Nope.
I can't see.
This is, tell me if this sounds familiar. This is an esophageal
Oh.
stethoscope. Okay, what this is used for, after the patient is intubated, this goes into the patient's mouth. This is inserted into the patient's mouth, and it goes down into the esophagus. With this, you can hear lung sounds, heart sounds. This connects to the machine, and you can monitor the body temperature. So, if this patient does not have a PA line, what's the best way to measure temperature?
The
Rectum.
lower esophageal.
It would be this right here.
Mhm.
So this is the best way to monitor
Say what that
temperature
is again.
if you do not have a PA line in the patient.
Can you repeat what that is again?
Esophageal stethoscope. And it does what?
It's the best way to monitor, if you do not have a PA.
What else?
Lung sounds.
Keeping heart
Lung
sound,
sound.
lung sound,
What else?
and body temperature.
Core temperature. Core body temperature. Everybody knows what this is, correct?
No.
See,
A tourniquet.
tourniquet. Use the start IVs. Tourniquet. Use the start IVs. TOURNIQUET. You probably don't know what this is. Anybody know what this little thing is? Somebody that work in a hospital would know.
That's the thing you put on the IV.
It's like
Yeah,
a port.
that's the thing you put on.
This is a stopcock.
Yep.
A stopcock. You connect it to either a drip that you're infusing, or sometimes people put it on IVs to have more ports to inject medication. This, anybody know?
That's,
Like the alcohol slide.
Chloroprep. This is used for regional anesthesia or central lines or A lines. When you prep somebody and clean them off, you have to let this dry for a few minutes before if you're using a Bovie, any kind of electrical device with heat, this has to dry for 3 minutes before you can use it. But if you're inserting like an A line or central line or something like that, you just let it dry for a couple of minutes. By the time you put your drape on, you can go ahead and use it. But this is called Chloroprep. And this is always needed for any sterile procedure that's being done by an anesthesia provider. Whether you're assisting with a block, whether the anesthetist is doing the block, the anesthesiologist is doing the block, always have Chloroprep with you. This. Any guesses?
That's a
Somebody
suction.
said it before.
It's for suctioning.
No. What kind of suction? It is for
Trach.
suctioning. No.
NG.
This is NG tube. Nasal gastric tube. This can go in the nose or it can go in the
Is it always
mouth.
blue on the end?
It depends on the company.
And you said it can go in the nose?
The nose or the mouth. What is this?
that's,
ET tube for who?
ET2. Look like pediatric.
Pediatric ET tube. So if you see this on a damn exam, don't write just ET tube. I need to know what kind of ET tube, okay? And let's go a little further. I didn't put a regular ET tube out here.
Is that cuffed?
I'm sorry?
The kids one is uncuffed, right?
This is uncuffed,
Mhm.
exactly. So that's one of the differences. This is an adult ET tube. This is a regular adult ET tube. Always has a cuff on it. Pediatric tube does not have a cuff on it. What are these? Just the basic name for
The
it.
nasal
Nasal.
ray.
Okay. Which one is nasal ray?
Right. Left hand.
Which one is a nasal ray?
They're both are.
Yeah, both.
The one in your left hand.
The one in the left hand. This is a nasal ray. This is an oral ray. So when this is in the patient's mouth, only this much hangs out right here. Okay? When this is in a patient's nose, this part is hanging out on his nose. Okay? They all have cuffs, except for if you had a pediatric one, they would not have a cuff. These are what? Anybody?
Needle.
I know it's a needle. Who said needle?
That was me. Or IV. I can't see.
Is that the spinal tap?
This is a spinal needle. All right, this is a spinal needle.
That's a long one.
This is for, this is a long needle. The reason we use long needles, this is a normal spinal needle right here. This is used for the average adult. Sometimes they have to use these for bigger patients. Say if we had somebody 400 pounds, they have a lot of sub-Q tissue to go through. So you need a longer spinal needle to go through their tissue, okay? What,
Face mask.
can you go to that classroom right quick? I'm gonna take a minute, cause a couple of people are missing. Can you walk to the classroom and see if anybody's in the classroom?
When you ready to do whatever you wanna do, you wanna do it. I'll go check.
Okay, thanks. So, any questions so far on what I went over? I'll wait till he gets back before I continue. So you guys, you should take, pictures or whatever